Dear friends, once again it's hearty and warm welcome in this new online lecture. Friends, in our today's lecture, we are going to learn two different topics. First of all, we shall discuss about the pulse and later on about the blood pressure, types of blood pressure, how is the way of measurement of blood pressure by using BP instrument, that is Manometer, and some of the factors affecting the BP. So first of all, let us talk about a little concept, that is pulse. Friends, all of you are known that the heart shows rhythmic contraction and relaxation. Heart itself acts as the pumping station of our blood vascular system, and because of its rhythmic contraction and relaxation, it receives the blood from certain set of blood vessels and pumps that blood forcefully into another set of blood vessels. We know that whenever the heart, especially the ventricles, undergo contraction, it means during ventricular systole, the blood is forcefully pumped into the arteries which already contain some blood. Let me explain you. Suppose, consider here is outline diagram of heart. I am going to show the left part and right part of the heart. Here is supposed to be the left auricle, left ventricle, and as we all are aware, from left ventricle it arises the largest blood vessel, that is systemic aorta, which further undergoes division, redivision to form arteries, arterial, capillaries, etc. So whenever the ventricles undergo contraction, I said during ventricular systole, the blood is forcefully pumped into the arteries. Consider here are the arteries formed by the division of aorta. So whenever the blood is forcefully pumped into the arteries, these arteries already contain some blood and therefore that arteries undergo expansion. Arteries expand to receive the incoming blood. Do you understand? ज्यावेळेला ventricleचं contraction होतं त्यावेळेला ventricles मधून blood हे फोर्सफुली आर्टरीज मध्ये पंप केलं जातं आणि आर्टरीज मध्ये आधी काही ब्लड प्रेझेंट आहे आणि म्हणून दिस इनकमिंग ब्लड हे नवीन आर्टरीज मध्ये येणाऱ्या ब्लडला रिसीव्ह करण्यासाठी ॲट द प्रॉक्सिमल पार्ट ऑफ आर्टरी इट शोज डिस्टेंशन. Arteries show distension. Arteries expand. Why? Just to receive the new incoming blood. And it is followed by the ventricular diastole. We know that the systole is followed by diastole. So during ventricular diastole, immediately the arteries undergo recoiling, means again attain its original shape. Now, due to the recoiling of this part of artery, that blood is pushed into the next part and the next region, next part further undergoes distension. Let me show you the diagram. Suppose this part shows recoiling, and due to which as the blood is pumped to the next region, therefore the next region distend, means expands. Now this thing happens continuously along the length of artery, and therefore this wave of distension and recoiling passes along the length of artery, and simply this wave of distension passing along the length of artery is known as arterial pulse. यालाच arterial pulse असं म्हणतात. मग arterial pulse ची व्याख्या आपण अशा प्रकारे करू शकतो. Arterial pulse is nothing but the wave of distension and recoiling passing along the length of artery. This arterial pulse can be felt at different regions at different points on our body where superficial arteries are located. Say the pulse can be felt as a jerk in the wrist region where radial artery is present, in the elbow region where brachial artery is present, along the corners of mouth, also in the temporal region, in the femoral region, in the ankle region. It means this wave of distension passing along the artery, it can be felt as a jerk in superficial arteries in different points at different regions on the body. Now, as the pulse is generated during each heartbeat, isn't it? Whenever it occurs the ventricular contraction, that is during each heartbeat, one pulse is generated and therefore the pulse rate is equal to the heart rate. प्रत्येक हार्टबीट मुळे एक पल्स जनरेट होत असतो आणि म्हणून जेवढा हार्ट रेट आहे तेवढाच पल्स रेट असतो. And that's why the heart rate can be recorded simply by counting the pulse rate. Of course, the pulse rate is affected by so many different factors. Say, in children, in female individuals, as well as in standing position, the pulse rate is more, comparatively more than in adult individual, in male individuals, as well as the person in lying position. The pulse rate is also affected by different emotional conditions such as anger, fear, stress, etc., anxiety. So here we have discussed about the pulse and pulse rate. Now we people have to discuss about the another major topic, that is blood pressure. So let us move to the next topic. Blood pressure. So dear friends, just now we have studied about the pulse and pulse rate, and I said that the pulse rate, it comes equal to the heart rate, and also I told you the different factors which affect the pulse rate. पल्स रेट वर परिणाम करणारे वेगवेगळे जे घटक आहेत त्याबाबत मी बोललो. We know that in normal adult human being the heart rate is 72 per minute, and that's why the pulse rate is also 72 per minute in normal adult human being. But whenever the heart rate and pulse rate increases above the normal level, say 100 per minute, this condition is called tachycardia. जर हार्ट रेट किंवा पल्स रेट हा 100 पर मिनिट जर झाला तर या कंडिशनला टॅकीकार्डिया असं म्हणतात. अँड व्हेन इट लोअर्स डाऊन, दॅट इज बिलो 60 पर मिनिट, दिस कंडिशन इज कॉल्ड ब्रॅडिकार्डिया. एनिवे, नाउ लेट अस टॉक अबाउट द ब्लड प्रेशर. Few minutes before I told you that during ventricular contraction, during ventricular systole, the blood is forcefully pumped into the arteries. Now this blood flowing through the arteries exert some pressure against the wall of arteries, against the wall of blood vessel, and therefore the blood pressure is defined as it is the lateral pressure exerted by flowing blood against the wall of blood vessel, simply known as the blood pressure. I am going to write definition at the blackboard. Blood pressure is defined as it is the pressure exerted by flowing blood against the wall of blood vessel. Here I have mentioned general definition of blood pressure. So I mentioned the pressure exerted by flowing blood against the wall of blood vessel. Now whenever the blood is pumped forcefully into the arteries from ventricles during ventricular systole, that's why the blood pressure is maximum in arteries and it falls down subsequently in arteriole, capillaries, venule, veins and vena cava. Actually in vena cava the blood pressure is negligible, almost zero, and that's why you know in veins and vena cava there are presence of valves to prevent the backflow of blood, to prevent the reverse flow of blood. And that's why during the measurement of blood pressure, the blood pressure is measured and considered in arteries. And therefore we can say that the pressure exerted by flowing blood against the wall of arteries is known as arterial blood pressure, which is considered in medical field. So we can write what is arterial blood pressure. आताच मी तुम्हाला म्हटलं की हार्टचं कॉन्ट्रॅक्शन झाल्यानंतर ब्लड हे आर्टरीज मध्ये पंप केलं जातं आणि त्यामुळे ब्लड प्रेशर हे आर्टरीज मध्ये मॅक्झिमम असतं आणि नंतर हळूहळू ते कमी होत जातं. आर्टेरियोल कॅपिलरीज मध्ये व्हेन्युल्स, व्हेन्स आणि व्हेना कॅवा मध्ये ते आणखीन कमी होतं आणि व्हेना कॅवा मध्ये ते ऑलमोस्ट निग्लिजिबल झिरो ब्लड प्रेशर असतं. आणि म्हणून ब्लड प्रेशर मेडिकल पर्पज मध्ये, मेडिकल फील्ड मध्ये आर्टरीज मधलं ब्लड प्रेशर, आर्टेरियल ब्लड प्रेशर हे कन्सिडर केलं जातं. आणि म्हणून आर्टेरियल ब्लड प्रेशरची डेफिनेशन आपण अशी करू शकतो, इट इज the pressure exerted by flowing blood against the wall of arteries. Now, the arterial blood pressure, it subsequently rises and falls due to the alternate rhythmic contraction and relaxation of heart. Whenever it occurs the contraction of heart, whenever it occurs ventricular systole, the blood pressure rises. And whenever it occurs ventricular diastole, that is relaxation, the blood pressure falls down. And accordingly, the blood pressure, it is of two types. That is systolic BP and diastolic BP. The meaning is very simple. Let me explain you. Systolic blood pressure, name itself indicates. Systolic blood pressure means it is the blood pressure during ventricular systole, during ventricular contraction. ज्यावेळेला ventricleचं contraction होतं, ज्यावेळेला ventricular systole होतं, त्यावेळेला जो blood pressure येईल त्याला म्हटलं जातं systolic blood pressure. And definitely it is comparatively more, and in normal adult human being it is 120 mmHg. While the diastolic BP, it is the blood pressure measured during ventricular diastole, during the relaxation phase of heart, and in normal adult human being it comes as 80 mmHg. And therefore generally the blood pressure is represented as systolic pressure oblique diastolic pressure, that is 120/80 mmHg. It means in normal adult human being the blood pressure is 120/80. 120 it represents systolic blood pressure and 80 it represents diastolic blood pressure. You must know that the difference between systolic and diastolic pressure is also known as pulse pressure. Let me write. Difference between systolic pressure and diastolic pressure is known as the pulse pressure. It means the pulse pressure in normal adult human being is 40 mmHg. Therefore, it is also represented that the ratio between systolic pressure, diastolic pressure and pulse pressure in normal adult human being is 3:2:1. In addition to that, I would like to tell you one more definition, that is mean arterial pressure. It is calculated as diastolic pressure plus 1/3 of pulse pressure. We know in normal adult human being the diastolic pressure is 80 mmHg and 1/3 of pulse pressure, that is near about we can say 13. So 80 plus 13, that is 93 mmHg. This is mean arterial pressure. Now we people have to understand about the measurement of blood pressure. Let me explain you. Let me tell you which instrument is used, which are the different parts of that instrument. Determination of blood pressure. Friends, all of you might be aware that in medical field the blood pressure is measured with the help of an instrument commonly known as BP instrument, or its name is sphygmomanometer. Sphygmomanometer. Here sphygmos, this word stands for the pulse, remember. Now first of all, let me tell you which are the different parts of this sphygmomanometer. Before to that, I would like to tell you the types of sphygmomanometer which are commonly used in medical field. There are three main types of sphygmomanometers used, such as first, mercury type of sphygmomanometer, second, aneroid type of sphygmomanometer, and third, digital type of sphygmomanometer. But the first choice goes to the mercury as well as aneroid. Means if the mercury type of sphygmomanometer is not available, then the aneroid is considered as quite accurate type of instrument and it gives quite good accuracy during the measurement of BP. Now here we have the actual mercury type of sphygmomanometer. I am going to tell you the major parts of this instrument. या ठिकाणी आपल्याकडे मर्क्युरी टाइप ऑफ स्फिग्मोमॅनोमीटर उपलब्ध आहे आणि त्याचे जे भाग आहेत ते आधी मी तुमच्या समोर या ठिकाणी मांडतोय, दाखवतोय. कन्सिडर, look, now here is the first part. It is known as inflatable cuff. Inflatable cuff, CUFF. Actually it is a rubber bag. It is covered by again a cotton cloth. It is known as the inflatable bag or inflatable cuff. It is wrapped around the upper arm of a person. ज्या व्यक्तीचं ब्लड प्रेशर मोजायचे त्या व्यक्तीच्या अप्पर आर्म भोवती घट्ट हे कफ गुंडाळलं जातं, बांधलं जातं. नाउ दिस इन्फ्लॅटेबल कफ हॅज टू रबर ट्यूब्स. या ठिकाणी तुम्हाला दिसत असेल त्याला दोन रबर ट्यूब्स आहेत. One rubber tube is connected with the rubber hand pump. Here is a rubber hand pump. It may be called as the rubber bulb. याला rubber bulb असं पण म्हणतात. It is provided with the valve. It is necessary to regulate the inflow and outletting of the air into the inflatable cuff. While the second rubber tube is connected to the mercury manometer. Here is a mercury manometer. It may be known as the pressure gauge. In this mercury manometer, the mercury is used, and that's why actually this type of instrument is called mercury type of sphygmomanometer. Now, all of you can see here is a glass tube, and at the base of glass tube, in small bulb, mercury is filled, and this mercury column raises upward due to the air pressure in this inflated cuff. ज्या वेळेला या रबर कफ मध्ये एअर भरली जाते त्याच्या प्रेशरमुळे या ग्लास ट्यूब मधला मर्क्युरी कॉलम हा वर जात असतो आणि ज्या वेळेला या इन्फ्लेटेबल कफ मधलं प्रेशर एअर प्रेशर कमी होतं त्यावेळेला अर्थातच तो मर्क्युरी कॉलम खाली जात असतो. याच्या आधारावर आपल्याला व्यक्तीचं ब्लड प्रेशर हे मोजायचं असतं. Now here I am going to demonstrate you. We have a student here and I am going to demonstrate how is the actual way of measurement of blood pressure with the help of this mercury type of sphygmomanometer. Please come here. So now, first of all, here I am going to wrap this inflatable rubber cuff around the left upper arm of the student. we have to wrap it very tightly. Then the air is pumped with the help of this rubber hand pump, so that the mercury column in this mercury manometer, it raises up. You can see I am going to pump the air. It raises the mercury column. Just to notice, simultaneously this rubber bag, this rubber cuff is inflated. Now due to this, as this rubber cuff is inflated, what happens? The blood flow through the brachial artery is temporarily stopped, and hence the pulse is not felt in this brachial artery, that is in this elbow region. As the pulse is not heard, then slowly the air is released out, due to which, as the rubber cuff is deflated, then the blood flow starts slowly through the brachial artery, and we can listen that sound with the help of stethoscope. Now once again here I am going to repeat. Once again here I have pumped the air, due to which the brachial artery is blocked completely. There is no flow of blood, so I can't listen any sound. But slowly, as this cuff is deflated, हळूहळू या ठिकाणी या रबर कफ मधली एअर ही रिलीज केल्यामुळे मर्क्युरी कॉलम हळूहळू खाली जातोय, आणि त्याचबरोबर स्लोली ब्लड फ्लो हा सुरू झालेला आहे. एका विशिष्ट पॉइंटला, ॲट पर्टिक्युलर पॉइंट, अ थॉपिंग साऊंड और पल्सेटाइल साऊंड is heard. That first pulsatile sound is nothing but the systolic blood pressure, or we can say that first pulsatile sound represents the systolic pressure. Now slowly the air is released. Still the pulsatile sound is there, but after some time that pulsatile sound is also not heard, and that point, when the pulsatile sound is not heard due to the smooth flow of blood, it represents the diastolic pressure. This is the way of determination of blood pressure. Now the blood pressure, definitely now sometime it occurs abnormal increase or decrease in the blood pressure, and accordingly there are two main types of abnormalities in blood pressure. There are two main abnormalities such as hypotension and hypertension. Let me explain it. Hypo, this word stands for less or below. Therefore, the hypotension is also known as low BP. Hypotension or low BP is defined as it is abnormal and persistent fall in blood pressure, decrease in blood pressure. असाधारण आणि कायमस्वरूपी जर ब्लड प्रेशर नॉर्मल लेवल पेक्षा कमी असलं तर या कंडिशनला लो बीपी किंवा हायपोटेन्शन असं म्हणतात. जनरली इन हायपोटेन्शन द सिस्टोलिक प्रेशर इट गोज बिलो 100 mmHg and diastolic pressure below 60 mmHg. While the second abnormality is hypertension, may be known as high BP. It can be defined as it is abnormal and persistent rise in blood pressure than normal BP. It is abnormal and persistent rise in blood pressure than normal BP. हायपोटेन्शन प्रमाणेच लो बीपी प्रमाणेच ज्या वेळेला व्यक्तीमध्ये असाधारण आणि कायमस्वरूपी जर ब्लड प्रेशर नॉर्मल व्हॅल्यूज पेक्षा जास्त असलं तर त्याला हायपरटेन्शन किंवा हाय बीपी असं म्हटलं जातं. In hypertension, the blood pressure is 140/90 mmHg. It is the threshold, that is, it is the boundary of high BP. But whenever the blood pressure rises up to 180/100 mmHg, that is systolic pressure above 180 and diastolic up to 100 mmHg or above it, definitely it is quite dangerous and it causes threat to the mankind. Anyway, here we have discussed about the two abnormalities of blood pressure. Now we have to discuss about the different factors affecting BP. Factors affecting blood pressure. There are so many different factors which affect the blood pressure. First, volume of blood. Volume of blood. We all are known that in normal adult human being, generally the volume of blood is near about 6.5 to 6.8 liters. But whenever it occurs, abnormal rise, abnormal increase in the volume of blood or maybe decrease in the volume of blood, definitely it affects the blood pressure. We know that during any serious injury, during accident or during major surgery, there is a possibility of excess of bleeding and it causes the fall in the blood volume. Ultimately, it affects the blood pressure. Second, arteriosclerosis. Arteriosclerosis means it is the hardening of the wall of arteries and arterioles. Hardening of the wall of arteries and arterioles, due to which there is loss of elastic nature. There is loss of elasticity, elastic nature of arteries. It is mainly due to the degeneration of smooth muscles present in the wall of arteries and arterioles, as well as due to the deposition of cholesterol and calcium in the wall of arteries. Actually, it is considered as degenerative disease, means it is caused in old age. So, second factor we have studied, that is arteriosclerosis. Third, atherosclerosis. Atherosclerosis means the narrowing of the lumen of arteries due to the deposition of fats in the lumen of artery, as well as the formation of plaques of cholesterol in the lumen of artery. Let me tell you, consider here is supposed to be the artery. I told you just now, in old age it occurs the hardening of the wall of artery. There is a loss of elastic nature of artery, and that's why arteries does not show distension and recoiling efficiently. It affects the blood pressure. Simultaneously, whenever it occurs, the deposition of lipids or the formation of such layers in the lumen, plaque of cholesterol in the lumen of artery, it leads to the narrowing of the lumen of artery. Artery मधली जी पोकळी आहे ती अरुंद होते and ultimately it again affects the blood pressure. Fourth factor, cardiac output. All of you are known that cardiac output, it is the volume of blood pumped by ventricles during 1 minute. It is the volume of blood pumped by ventricles per minute, and in normal adult human being it is near about 5 liters. But whenever the cardiac output increases, the blood pressure also increases. It means the cardiac output is directly proportional to the blood pressure. Next factor, peripheral resistance. peripheral resistance is depend upon the diameter of blood vessels. Decrease in the diameter of blood vessel or constriction of blood vessels due to the vasoconstrictor, ADH hormone, antidiuretic hormone, which may be called as the vasopressin. It bring about the constriction of blood vessel, and due to which there is an increase in the peripheral resistance and it affects the blood pressure. Next, viscosity of blood. We all are known that the blood is viscous in nature, and the viscosity of blood is mainly depend upon the plasma proteins, that is albumin, as well as the RBCs. Now whenever the viscosity of blood increases, definitely the blood pressure increases, and whenever the viscosity of blood decreases, the blood pressure also decreases. It means the viscosity of blood and blood pressure are directly proportional. Next one, venous return. Venous return means it is the volume of blood carried back by veins up to the heart. Veins मार्फत जेवढं रक्त हार्ट पर्यंत परत आणलं जातं, हार्ट मध्ये परत आणलं जातं, त्याला venous return असं म्हणतात. More is the venous return, more is the blood pressure. Less is the venous return, less is the blood pressure. It means here we have considered some of the important factors which affect the blood pressure, such as volume of blood, arteriosclerosis, atherosclerosis, cardiac output, peripheral resistance, viscosity of blood, and venous return. In addition to that, there are certain other factors which can affect the BP, such as the obesity, overweight, then the different types of addictions, say smoking. We know that the inhalation of smoke of tobacco, smoking, the smoke of tobacco contains the nicotine, and definitely it brings about the constriction of blood vessels and it leads to the hypertension, high BP, or alcoholism, that is the drinking of excess of alcoholic beverages. It also affects the heart functioning, subsequently it affects the blood pressure. Also we can say the different emotional conditions such as anxiety, fear, stress, anger, etc., etc. So these all are the different factors which affect the blood pressure. So let us stop here today. Thank you and bye.